So bone grafting, what's involved? And what procedures does somebody even need a bone graft?
If they're losing their teeth and they have big sinuses that have no bone to support an implant case, in the past, we used to do what's called a sinus bone graft. We'd put bone into the sinus. It would take about 6 months to mature into patient bone. Then we would place the implants. They would heal in the bone for about 6 months. Then we would do the restoration, another 6 weeks or 8 weeks, 2 more months. So it takes more than a year to do these kind of cases.
And that's still being done that way today?
It's still being done in many, many offices. We do what's called graftless techniques. If I could place implants around the sinuses and in different areas of the mouth, we're able to stabilize them using the methods that we discussed in the textbook. We're able to give a patient a graftless solution where we could give them the teeth the very next day. So on the one hand, grafting, a year and a half, 2 days later, it's not that big of a difference. You could figure out yourself. You could figure out what.
So it's very important that the patient, because patients, I guess it would be intimidating to say, tell me about your experience. How many of these have you done? So experience matters when it comes to implant dentistry.
Well,
I mean, it seems like an obvious question, but
it does matter.
Elaborate on that.
It does matter, and I've actually been involved in implant dentistry for many years. So I've actually been part of the evolution, part of the revolution, and we're part of the new techniques that are coming out tomorrow. As a matter of fact, Randy, I have a project right now at a university in Portugal. We're studying new materials for the teeth not even being done yet. And we're comparing them to 4 different methods that are being done today. And we're doing all sorts of mechanical testing. This is going to further revolutionize the methods. And when I say further revolutionize, I mean it's going to be more straightforward for the dentist, more straightforward for the lab technicians. What does that mean? It means a better, faster, quicker, and more cost-effective product for the patients. If we're able to treat as many patients as we can, eliminating money as a problem by actually having a more cost-effective technique, we want to do that. We love helping these people, and if we could lower it, it's a great idea.